All right, new here at 4, at least one case of measles has now been reported in East Tennessee as of today. The highly contagious disease has many parents concerned, and here to tell us what we need to be thinking about right now, Dr. Shannon Cohen, a physician at Children's Hospital. Thanks so much for coming in.
Thank you.
So, I mean, this is a topic that we haven't really had to talk about for a very long time, but so it's almost kind of like a refresher course for everybody. But when it comes to measles, what kind of things are we looking for, and what are we talking about here?
So some of the symptoms: high fever, full body rash. It generally starts on the face and then generalizes to the entire body. Cough, some respiratory symptoms, and some redness of the eyes.
Okay, and this is a virus, right? So, and that's what's so tricky about this, because it can kind of be out there, but you may not know. You may not know you even have it for several days.
Right. So it's spread by contact with the virus. You can get that from droplets in the air or from touching a surface. And those droplets or surface germs can be passed for 2 hours. It can live on those surfaces.
Right, so someone could touch it, walk away, you could come along and brush up against it and you not even know, and still you wouldn't even know for maybe a couple days that you even have measles, right?
Right, and you can spread it 5 days before the rash even outbreaks on you, so you could be spreading it and not even knowing.
Because this is a virus, is this something that basically, I mean, obviously you want to see a doctor, but so this just kind of have to kind of run its course to a degree, isn't it, as far as trying to get rid of measles if you do come down with it?
Correct. There's no medication we can give to make it go away. We just support them through the illness, rest, fluids, fever control, and time for the body to fight off the infection.
And what kind of things then obviously do we need to be thinking about? Any precautions we need to be taking? I mean, obviously you don't know if someone has come in contact with it, but I guess it's kind of the standard, you know, wash your hands, stay clean, you know, whatever you have to do.
Right, and if your child is sick and you're concerned about that, you would recommend that we minimize exposure to others. And the best prevention that we have is vaccines.
Right.
So make sure your child is getting their recommended vaccines.
Yeah, we heard from a physician earlier talking about the more people that are vaccinated, if you have fewer that are not vaccinated, then that's the less chance of spreading measles, I guess is the way to look at it. So anything else we need to think about? I mean, I know you said make sure you kind of seclude them, put them in a back room or put them in the family room or wherever. Less contact, the better, you know.
Right, and if your child is fully vaccinated, then, you know, the concern is much less.
And is there a point where you can or can't? I mean, as far as like age, as far as vaccinating, do we know to get the measles vaccination?
Right, so the recommended is at 12 to 15 months, and then the second one is a booster right before kindergarten, between 4 to 6 years of age.
Okay, good to know. Thank you so very much for coming by. I appreciate it very much.